Hello, welcome to our Friday Facebook Live. I'm Dr. Jennifer Greer. I'm a board certified plastic surgeon in Cleveland, Ohio. And if you haven't met me before, welcome to my weekly Facebook Live video. I do love getting questions from you guys. And today I'm going to talk about something for guys, which I do admit I spend a lot of my time on women. That is a large portion of my clientele. But today I'm going to focus on the guys. And what we're going to talk about is gynecomastia. This is a topic that I think a lot of guys are really sensitive about because it's something you feel really self-conscious about. Guys want to have a nice flat chest and sometimes they don't. So today I'm going to explain a little bit about what causes that. Gynecomastia is a term that's thrown around a little bit without a really clear definition. And there's actually two common causes of a chest that's not flat. There's true gynecomastia and then there's pseudo-gynecomastia, meaning it's fake gynecomastia. So true gynecomastia is actually formation of glandular tissue. So it's actually breast tissue. And this can happen for a lot of normal reasons. There are 3 times in a guy's life when it's actually super common. One is at birth. There is estrogen from the mom still floating around in the blood supply, and this can cause formation of a little breast bud. I know this totally freaked my husband out when my son was born, but it's completely normal and it goes away. The other time that gynecomastia is really common is during puberty and then also during older age, like over age 65. And those 2 times are just because the balance of estrogen to testosterone is fluctuating a little bit, and when things get off kilter, it can form a little bit of breast tissue in the body. So that is true gynecomastia. It'll feel like a little hard disc of tissue right under the nipple and it may be tender. Now, pseudo-gynecomastia is actually just fat, and that may look a little bit more like a breast or be a little bit softer and squishier. That is more often caused by just having a little extra weight on the body. And you can have both true gynecomastia and pseudo-gynecomastia in the same person. It's not at all unusual to have both going on. Now, when is a good time to see your doctor? If it's a new onset and it's something you're worried about, it's always worth getting a checkup. But if you've had a little bit of gynecomastia or extra fat for over a year, you haven't started any new medications, and things are stable, then it's okay to skip right to a plastic surgeon for evaluation and treatment. And there are some really great treatment options available. I'm not going to go into them all today because that's a pretty lengthy discussion, but I do have an awesome downloadable PDF, which is a guide to treating gynecomastia. And my assistant Rachel is going to put a link to that in the comments. So if you want to find out more about how to treat gynecomastia, just go to the comments, click on that link, give me your email address, and we'll email that to you right away. And as always, if you have any questions, you can reach out to us at 440-974-8577. Thanks for joining us, and I will see you next week.